This is part 2 of the lecture Care of the Newborn. In this lecture, we will talk about the neurologic assessment of a newborn. So when we say neurologic assessment, we are talking here of the function of the brain, which is evident with the reflexes of a neonate. This is also known as developmental, primary, or primitive reflexes. And by assessing these reflexes, it provides information about the lower motor neurons and muscle tone. Reflexes are protective and they disappear as higher level of motor functions emerge. So let's start with blinking or corneal reflex. Infants blink when there is sudden appearance of bright light or at approach of an object towards the cornea. Now, this blinking persists throughout life. The pupillary reflex, that is when pupil constricts when a bright light is shined towards it. And as we all know, this persists throughout life. The doll's eye reflex. So how is this? As head is moved slowly to right or left, the eyes will lag behind and do not immediately adjust to the new position. Now this is normal. Now this will start to disappear as fixation develops. Thereby, if this doll's eye reflex persists, this indicates neurologic damage. Then we have the sneezing reflex, which is a spontaneous response of the nasal passages to any irritation or obstruction. This persists throughout life. This makes sure the nasal passages are always clear. Then we have the glabellar reflex, whereby tapping briskly on the bridge of the nose will cause the eyes of the newborn to close tightly. Now, as we mature, this will disappear because the brain or the eyes will have better control. Sucking reflex. This is elicited when the examiner strokes the lips of the infant. The infant's mouth will open and the examiner introduces their gloved finger and the sucking will start. The rooting reflex. This will disappear in 3 to 4 months, elicited when the examiner strokes the cheek or corner of the infant's mouth. The infant's head will turn towards the stimulus and open its mouth. Gag reflex. This is the stimulation of the posterior pharynx by food, suction, or passage of a tube, which causes an infant to gag. And this persists throughout life because gag reflexes are natural reflexes which helps the babies learn to eat safely. Extrusion reflex. Now, when the tongue is touched or depressed, the infant automatically responds by forcing it outward. This disappears by age or months. Yawning reflex, a spontaneous response to decreased oxygen by increasing the amount of inspired air. Palmar grasp reflex. This is elicited when the examiner places his finger on the palmar surface of the infant's hand. The infant's hand will grasp the finger, and this will disappear when the infant turns 2 months. Tonic neck or fencing reflex. This is elicited by rotating the infant's head from midline to one side. Now, the infant's response will be extending the arm on the side to which the head is turned and flexing the opposite arm. Similar is the response in the lower extremities. This disappears in 7 months. Then we have the Moro reflex. Okay, the examiner holds the infant so that one hand supports the head, the other supports the buttocks. Now, the reflex is elicited by sudden dropping of the head in her hand. And the response is a series of movement. The infant's hand open and there is extension and abduction of the upper extremities. This is followed by anterior flexion of the upper extremities and an audible cry. Or another way of saying it simply, this is the startle reflex. Like the infant is startled and afraid it would fall. Now, what is the significance of this moro or startle reflex? When it is absent or inadequate, this could be a sign of hemiplegia or brachial plexus palsy or a fractured clavicle. Now, if it persists beyond the age of 5 months, it can also indicate severe neurological defect. So again, this is your moro or startle reflex. The dancing reflex. So some parents would say, oh, my infant is already learning how to dance as early as 2 months. Well, this is elicited by touching the top of the infant's foot to the edge of the table while the infant is held upright. Immediately, the infant will make movements that resemble stepping. Then the Babinski reflex, which disappears by age of 1 year. This is elicited by a stimulus applied to the edge of the sole of the foot. So the infants respond by plantar flexion and either flexion or extension of the toes. Okay, so the toes will react when the uh, soles of the foot are stroked. Crawling reflex. When placed on the abdomen, the infant will try to crawl with arms and legs. This disappears at the age of 6 weeks. The Harlequin color change. So look at this infant. There are color changes as the infant lies on the side. Lower half of the body becomes pink or red and the other half is pale. Now, don't worry, this is entirely harmless. It is not permanent. The torticollis or wry neck. The head is held to one side with chin pointing to the opposite side, and this can be due to positioning of the infant or the fetus inside the womb. The infant may need exercise of the neck to resume the good position. So those are the different reflexes expected in a newborn. Now, how about if a newborn is born preterm? Okay, so what could be problems when the baby is born way ahead of time? So we have long-term complications. We have brain issues such as cerebral palsy. This is a disorder of the movement of the muscle, tone, and the posture. So the reflexes will really be absent or inappropriate. There would be vision problems like retinopathy, um, some degree of hearing loss, and chronic problems like asthma and feeding problems because some organs are not yet fully developed. Now, every 1 in 10 women has the risk of delivering babies prematurely. And when babies are premature, they have higher risk for developing serious health problems. And so, if it's inevitable, the baby is premature, then the care post delivery can help prevent further complication and ensure that even though born prematurely, the baby can still have optimal health in the future. Okay. So, when babies are born prematurely, there are greater rates of death, necrotizing enterocolitis, or that's the dying of the intestines, and respiratory issues. Now, there may be need to support the newborn with glucocorticoids, okay, and support if there are bleeding going on. Now, here is another good list that would show some of these infant complications. So, by system. So, let's start with the eyes, ophthalmology. As we say, there could be retinopathy. In the brain, there could be bleeding and also poor development. The GI can have dying intestines, your necrotizing enterocolitis. The heart, there could be some holes in there, your patent ductus arteriosus that fails to close, which is supposed to close as the baby mature. And the major issues would really be in the lungs. There could be RDS or respiratory distress syndrome, dysplasia, apnea, or simply failure of the lungs to expand as necessary to accommodate exchange of gases. Now that's for the premature. How about the post-mature infant? Okay. So after 42 weeks, please take note that placenta already loses the ability to nourish the fetus inside the womb. That's why it can cause some not good complications implications to the fetus. Infants born of a gestation that extends beyond the 42 weeks are called post-mature infant, and these are some of the signs. The nails are already long, the skin are starting to peel. What causes the post-mature delivery? Sometimes it's not clear, or it is probably because the placenta did not function adequately, and mortality and morbidity increase than term infants. So it's not a good scenario. Now, characteristic of a postterm baby: there is decreased amount of soft tissue mass, skin hang loosely, it's already dry and peeling. The nails and the umbilical cord can already be stained with meconium. So those are your complications when the baby is born prematurely and also post-maturely. So we always pray that the baby is born just on the right age. Okay. Now, um, hoping that our baby is healthy, these are the general care that we have to remember. So we make sure that the newborn is kept with the mother for continuous rooming in a well-ventilated room. Baby should be handled with gentle approach. Always wash our hands. No infected person should take care or touch the baby. Baby should be sleeping in supine position, not prone, because apnea can occur when the baby is sleeping prone, which is the causative factor for sudden infant death syndrome. Of course, maintain the environment clean, and if the diaper is wet, this has to be changed immediately. So here on one side, you can see reminders of a newborn baby care first month. So established a feeding schedule, diaper changes have to be routinely done, established sleeping patterns, although baby is generally sleeping all the time. Don't forget, it's not only the baby that we're taking care of, we're taking care of a mom who just delivered, so self-care of the mom is important. There is a need to do doctor's visit certain time. The first would be 6 to 8 weeks after delivery. Bathing will have to happen sometime, so we take care that baby is safe in bathing. The cord is soon gonna come off, and so how do we make sure that it is not infected? Baby's temperature regulation is still young and immature, so we recognize cues when the baby is cold, or how do we keep the baby warm and cozy, and bonding time with the mom is also promoted. Now, going back to that temperature, we want to make sure the baby is not cold, because shivering can use energy and that can deplete the infant's energy. So warmth is provided by keeping the baby dry with adequate clothing. Baby should be kept to the side of the mother, because the mother's body temperature can keep the baby warm. Remember, the baby is still learning how to adjust in the outside world. Now, baby can be placed in skin to skin contact with mother. This is called kangarooing. This is to maintain temperature and facilitate breastfeeding. Now, bathing at first day is avoided because this can lead to hypothermia. And if the temperature dropped, the baby would need more energy to build up the warmth. That means more calories are needed, more food is needed. That's a lot of adjustment for a newly born baby. Now, in terms of breastfeeding, baby should be put to mother's breast within half an hour of birth as soon as possible. The mother has recovered already from exertion of labor, and breastfeeding also helped the uterus to contract, because the sucking reflex in the breast will stimulate the production of this oxytocin. Colostrum, which is the first portion of the fluid coming out from the breast, is offered. Mother should be informed about importance and techniques of breastfeeding, so this should have been done prenatally. Demand feeding is encouraged. That means feed as the baby wants to. And exclusive breastfeeding procedures should be explained to the mother and family members. So, as much as possible, just give breast milk, so that we also stimulate the breast to continuously produce the breast milk. Now, how about baby bath and skincare? So, baby will be cleaned off from the blood, the mucus, and the meconium, but in cleaning the baby, no vigorous attempt to remove those vernix caseosa. Those vernix caseosa actually provides protection to the delicate skin of the newborn. A baby bath can be given in the hospital, but make sure it's warm water in a warm room, and it's done gently and quickly. No bathing in open spaces or places because of the draft or the cold temperature. And during winter months, baby should have sponge bath rather than deep bath to avoid hypothermia. In relation to the umbilical cord, now take note, the cord is cut about 2 to 3 inches from the navel. It is with It was done aseptically during delivery and tied with cotton thread or plastic clip. Now, this cord must be inspected to see if they are bleeding, and usually it will shrink, and it will just fall off. So no dressing is applied. It's best if it's kept open and dry, so that it will fall off within the 2 weeks. Okay. Application of triple dye or junction violet is not advocated. Just keep it nice and dry. And avoid baths until it has fallen off. Just sponge bath first. Now fold baby's diaper down so it doesn't irritate the area where the cord is. So put loose clothing on the baby. Don't pull off the cord. It should just come off naturally. Now, Newborn care is always done immediately after birth. Again, emphasis on maintaining warmth. Um, have oxygen ready, especially if this is going to be the first care given. Make sure newborn identification and registration is immediately done. This is to avoid switching of babies or kidnapping occurring in the facility. Now, ID band is placed around the newborn's arm or leg, and this contains the mother's hospital number, mother's full name, sex, date, and time of the infant's birth. And the newborn's footprints are then taken and kept for permanent identification. Now, the registration of the infant is taken care by the physician or maybe the nurse midwife who supervised the delivery. The mother's name, the father's name, and the infant's name and birth date, of course, are recorded. And the newborn's chart information will also be completed. Okay. The UPGAR score will be recorded. If there was an eye care given, like a prophylaxis, immunizations, everything should be noted in the infant's chart. Okay. Now, here is a general tip for the newborn. Make sure that it says here delayed cord clamping that allows milking of nutrients more from the placenta to the newborn. So don't cut right away if you're the one assigned to cut. Skin to skin contact. Okay? Again, the emphasis on the temperature. Hypothermia is avoided, encouraging breast milk, okay, and assessment for danger signs. Now, during the postpartum, we are reminded that different families have different cultures. So, during the initial feeding, a newborn could be fed immediately after birth, while a formula fed one should be fed 2 to 4 hours of age. Bathing is done an hour after birth to gently wash away the vernix caseosa. The nurse must supervise the bathing together with the parents. It is also an opportunity to teach the parents. Okay? Keep the room warm to prevent the chilling. Bathing should be done before feeding because if it's done after, the newborn is at risk of aspiration and vomiting. Okay, so prepare the equipments for bathing. um, Start the bathing starting with the cleanest area, which is the eyes, towards the dirtiest area. Okay, never use soap on the baby's face. Do not soak the cord. And then, as a reminder, when sleeping, baby should be supine, not flat on his chest. Okay? No pacifier when the infant is sleeping. Kept the baby dry. We can put petroleum jelly on the buttocks to avoid breakdown when ammonia accumulates. And vaccines have to be given: Hep B, vitamin K. Those are some of those important vaccination. And above all, keep baby secure and safe. Now, here are some resources that you can click on. It has some sample NCLEX questions related to newborn care. This can help you study and prepare for this topic, care of the newborn. Okay, that ends our lecture.